April is National Donate Life Month, and Spectrum News 13's Stephanie Quinu goes in depth with an expert on the importance of organ donation and how you can help save a life.
Joining me today is Dr. Timothy Laird, Chief Medical Officer at Health First in Brevard County. Dr. Laird, thank you so much for joining us today.
Hello, it's my pleasure.
So April is National Donate Life Month. For folks out there, can you share with us why it is so important to recognize this month?
Yes, thanks. Yeah, so Donate Life Month is the time when we celebrate the generosity of our friends and neighbors who have given the gift of life to their fellow citizens. And also we recognize the professionals that are involved with transplants. There's 100,000 people waiting for organs in our country. And so Donate Life Month is when we kind of recognize that and kind of remind people how to participate.
And that is the most important gift, which is the gift of life. So, Dr. Laird, a lot of us know about becoming an organ donor, adding that to our driver's license. But there's also something as what's known as a living organ donor. So can you explain to us the difference between a living organ donor and donating after death?
Right. So there are people who find out either because they sign up for a national donor registry or other program that they have a friend or family member who needs an organ, and kidneys being one of the more common organs to donate as a living donor. Of course, many of us donate blood, bone marrow, all of those sorts of transplants or donations can be done by a living donor, not just after you're deceased.
Okay. You mentioned the 100,000 people who are waiting for an organ transplant. Can you talk to me a little bit more about the waiting list for organ transplants, how exactly it works?
Yeah, so there's a computer controlled waiting list that judges who's next on the recipient list based on a lot of factors, not only geography, but also, of course, disease severity and compatibility with genetics and blood types and that sorts of things. It's very kind of complicated, but it's very controlled and regulated too, and it's well done in this country.
Okay, so you'd mentioned, people can donate blood, they can donate bone marrow. When it comes to organ donation, can you share with us why there might be a hesitation when it comes to donating an organ? Why are some people maybe not as encouraged to do that?
Well, it's kind of an uncomfortable conversation in general. A lot of us are hesitant to really think of our own demise and that sort of thing. Many of us have done the driver's license notation, as you mentioned, and it's easy to check. You can look under your photo, under your signature, and just see if the words organ donor are there. But even more important than the driver's license notation is have you talked to your family about it? Make sure that your family, your friends, that sort of thing, know your wishes, because it's a really gut-wrenching time for them when if something does happen to you or to me, they have to make that choice. My family knows very clearly that I want to be an organ donor. No questions asked when, if I am able at the end of my life. So make that clear to your family and friends.
So, Dr. Laird, you mentioned that this might be an uncomfortable conversation for people. I'm interested in having how that has related to the pandemic. Are you seeing that more people are even more hesitant because of what's happening with COVID-19?
I'm glad to say no. The last year, there was actually a record number of organs transplanted, over 39,000. And so, as much division as has been talked about in our country, we are very unified and very altruistic when it comes in general as a people, when it comes to donations and helping our fellow man with organ donation and transplantation.
Well, that is a very uplifting statistic. I'm curious, folks who might be watching this, perhaps, they're a donor, but they did contract COVID-19. They were sick and maybe even had long-term complications. For people who are wondering, is it still safe if you were in that position to donate your organs?
Yes. Nobody should feel like either due to their age or their medical history that they're ineligible to participate in organ transplantation. And so generally it's safest and best to if that is your wish, to go ahead and plan on that. A lot of testing and things like that are done at the time to make sure that your organs are safe and transplantable and that sort of thing. But COVID isn't affecting that at this point.
All right, good information to know. Saving lives through organ donation. Dr. Timothy Laird, Chief Medical Officer at Health First in Brevard County. Thank you so much for going in depth with us today.
My pleasure. Thank you.